An Ontario Liberal MP is back on the front lines of this crisis after a Covid-19 diagnosis put her on the sidelines. Kamal Khera has a background in nursing. She signed up to help shortly after the pandemic was declared, but then Khera tested positive in late March. About a month later, she was given the all clear, and now she's working in a hard-hit long-term care facility alongside the Canadian Armed Forces. So what's it like to recover from Covid-19 and then go back to the front lines of this pandemic? Kamal Khera is a nurse and the MP for Brampton West. She joins us from Brampton. Hi, Ms. Khera. Good to see you.
Hi, Vashi. Good to see you, too. Thanks for having me.
So you look very well. I just want to check in. I know, of course, you had, and we reported on, contracted COVID-19, tested positive for it. Tell us how you're feeling now.
Much better. Thank you so much for asking. The journey itself wasn't easy, but it was as expected. But I'm very thankful to all the public health officials and especially Peel public health nurses who truly got me through this whole experience and this journey. And I feel much, much better. Thank you.
What was the experience like for you? It's interesting because we've been talking to all these people lately who have recovered from it and had severe bouts of it. We know there's such a variance in kind of the degree of the symptoms that you have. What was the experience like for you?
For me, particularly, Vashi, it was, I had some good days and I had some bad days. It started off like flu-like symptoms initially. Then I went off to having fever, shivers, to cough, headaches. Headaches were really, really bad. Body aches. There were days that I absolutely couldn't get out of bed. And as I started to get a bit better, I realized I had this very rare symptom of, I had these rashes all over my body. This is not your typical COVID symptom, but I was later told that this is a viral rash, which some patients may experience. So that was a bit scary for me because I've never seen something like that before. And even after I started, it was, I think, 3 weeks down and I was feeling a bit better. I went downstairs for the first time. And even then, I feel like I just didn't have that lung capacity as I did before, just coming up and down the stairs. But I'm very thankful for the public health nurses who, really checked up on me almost every single day. Very thankful for them for all their support, and not just in managing my symptoms, but also the emotional support that was provided to me. And I'm very grateful.
And were you home throughout the whole time that you were recovering and that you were ill?
Yes, I was home in my room for like literally a month.
Wow. So it took a full month before you really felt much better.
That's right. I mean, again, there were days that I was feeling a bit better, but I knew, next day after I'd still have a cough, I'll still have a fever. So till I was fully recovered and I had no symptoms, and as with the recommendations by public health nurses every single day, I was given the clear. I think almost 3 weeks. I think it's been 3 weeks now since I've recovered.
You're the first adult I've spoken to who spoke about the rash. Although lately we've been seeing all these reports of kids, particularly south of the border, who are showing evidence of a rash and testing positive for the antibodies that show that they had it. Is it something similar to that, do you think, or?
Again, I'm not particularly sure. What my physician put it best is, and my family doctor, who I send pictures to, and those are some of the pictures that I had shared online as well when I talked about my journey and my experience. And she said, well, you have a virus in your body. So this is a viral rash. It happens with a lot of different viruses. So this is something, it was new to me as well, because I had been doing a lot of research, and, like every other Canadian, we are all experts, I tell you, looking at the symptoms and kind of seeing, what this could be. And I didn't see anything like that. So that was a bit scary for me, but it was a viral rash, and it eventually got better after a few days. So I've nothing since then.
So since you recovered, you resumed your volunteer activities, right? Back in a long-term care home. Can you tell us about that experience?
Yeah, certainly, Vashi. You may have recalled, I think it was initially when RNAO's initial call to action came forward to ease the nursing shortage. I had put my name forward. I love being at the front lines. It's one of the reasons why I got into politics. And of course, a few days after I had signed up, I was diagnosed with COVID-19, where I spent almost a month recovering at home. But since my recovery, I had the opportunity to extend my services as a volunteer nurse at the long-term care facility in Brampton, where there is a COVID outbreak. This is one of the long-term care facilities also where a military assistant was requested. And I'm extremely proud that our government have been able to deliver on that request. And it's been almost 3 weeks that I have the honor of working alongside our incredible Canadian Armed Forces. This has truly opened my eyes to a lot of what our frontline workers, our healthcare workers are facing every single day. They're putting their lives at risk so that we can stay at home and be safe and to continue to provide for our most vulnerable and our seniors. And that's why, I go out there and I've been doing a lot of even, ethnic media and in the community to talk about the fact that we have to do our part. We have to do our part and continue to listen to our public health official, to continue to practice physical distancing and be extremely careful and mindful when we are now going out for essential work or for groceries and to pharmacies.
What kinds of things have you been doing in the home?
So just like as a nurse would do at a long-term care facility, I have been from helping administering medication to helping with their activities of daily living, whether it is changing them, bathing them, making sure that we're feeding them or providing them with emotional support. I've worked in a long-term care facility before, prior to me getting into politics, but it's been certainly a few years since I've gone back to nursing and to work with some of the most incredible nurses and frontline workers. And I do want to, give a huge shout out to these particular nurses that I've been working with. Vashi, it's been such a challenging time, of course, for the residents, their families and our frontline workers. Not only are they risking their lives, they're working twice as hard because when you have an outbreak such as this, with this particular long-term care where there were 55 residents and there were 20 staff that were positive, you have very limited resources, you have very limited staff, and you have vulnerable seniors. It is so overwhelming. And to have worked with these incredible people, I can tell you they give all to their work for their residents. I'm talking about nurses who stayed over 3 weeks at a long-term care facility herself to take care of these residents. I am so honored to have met and worked with these heroes. I'm so thankful and grateful that we have military help, and you can see that the staff is so appreciative of the support of our military. And it's not just the fact that there's physical bodies or extra help, but it's that emotional support. It's that, the need of making sure, our government and we have their back and that we're in this together. And I want to share this one instance, where a shift ended. It was one of the first days where a shift ended for our military nurses, our military staff rather, and all the regular staff just, waited for them and applauded for them. And it was such a truly proud Canadian moment, and I can't express in words how proud I was to be there and to experience that, the whole community and all the frontline workers coming together and appreciating the support.
Yeah, I think, we're, as Canadians watching it all unfold, we're all so grateful for the work of so many people who are working in these homes. And I'm wondering, in your sort of other capacity as an MP, as a politician, there has been a lot of discussion about what it even says that the Army had to go into these homes, what it says about the system more largely. And I know these questions are questions that you're going to grapple with in Parliament in the months and the years to come once we're hopefully on the other side of this. Yeah. But from your perspective, sort of not taking away the partisanship around any of it, do you think there needs to be sort of a systematic inquiry or commission or look into what went wrong across this country in those homes?
No, certainly. If you look at it, like we can all agree, especially with this pandemic, we've been exposed to the vulnerabilities that are long lasted. These are not new. These have long lasted in our long-term care facilities. We can all agree on that. And what we're also seeing is every level of government and every party aside, I would say completely non-partisan issues where governments are committing to doing better, and we must do better for our seniors. We owe it to them. What I can say from our government's perspective, we've been working very hard with our provinces and territories, providing them with the support that they need, including the help from our Canadian Armed Forces, which I can attest to is extremely appreciated as a frontline worker. And I know personally for me, I am doing my part as a nurse right now in my capacity at the long-term care facility in my community. And once this is all over, hopefully soon, we have a lot of discussions that we need to have. But as I said, health, again, is a multi-jurisdictional area. We will need to see how federal government can play a role in that. And right now, but as you know, the focus is on making sure that we get the help to our seniors right now. And that's exactly what we're doing.
Okay, I'll leave it there. Thanks so much, Ms. Khera. Really appreciate making time for us and glad to see that you're better.
Thank you so much, Vashi, and thank you for all the work that you've been doing. Thanks.
Thanks a lot. Kamal Khera is a nurse and the MP for Brampton West.